I'm David Teitelbaum. I'm an osteopathic physician and have practiced in the Fort Worth area for almost 30 years. For over 20 of those years, I've provided prolotherapy for my patients. Prolotherapy is the injection of ligaments to thicken and strengthen them. You can also use prolotherapy on tendons. Ligaments are the leathery straps that connect bones to bones, and tendons connect muscles to bones. In prolotherapy, we inject those structures with chemicals that deliberately irritate them. In response to that, the body lays down collagen and they thicken and strengthen. The two main irritating chemicals we use are dextrose in a concentrated solution and polydocanol, which is an irritating local anesthetic. Although it seems counterintuitive to think that injections of an area can bring about natural healing, that is the case with prolotherapy. The shots themselves do not bring about the healing. The shots themselves simply stimulate the body to heal itself so that the tissue that forms is a natural thickening of the tissues that are already there. Prolotherapy can be quite useful for a number of problems. In spinal conditions, we use it in the neck for whiplash injuries and for other neck injuries, and also in tension headaches along the base of the skull. We use prolotherapy for low back pain regularly and sacroiliac problems. We also use prolotherapy quite a bit in sports medicine for shoulder injuries, where we've done a number of pitchers, and people with rotator cuff tears that are not complete tears of the tendons involved. In elbows, we treat golfer's elbow and tennis elbow, and the wrist, a host of problems, strains, sprains, and even carpal tunnel. We do inject hips. We also do knees for collateral ligament tears or for cruciate tears if the ligament is not completely severed. We also do ankles for sprains and strains and certain foot problems. Prolotherapy is a very useful modality in my practice, so I wanted to make this video to explain it to my patients, and you will get to see me provide prolotherapy in a shoulder and a knee. This is Jay. Jay is, as you can probably tell, a professional bodybuilder. As a consequence of that, he suffered some damage to his biceps muscle and also to his deltoid. So we're being very target specific, injecting only the sites that are actually the source of the problem. I've already predetermined this first one. It's the biceps and stick. And the second point, Jay's going to help me find.
Yeah.
Is that it?
Yeah.
Okay. And here's the second one. And stick. And we're done. On this patient, we're going to inject the knee, the collateral ligament, on the inside, the medial collateral ligament, the medial coronary ligament, and they're going to inject into the knee because she also has some cruciate ligament damage. Cruciate ligaments are deep within the knee. So we're going to start with the collateral ligament and stick. Again, we're going for the targeted sites. Medial coronary ligament. There. Okay. And stick. Medial collateral ligament. And last, we're going to do the cruciate ligament. The cruciate ligament is deep within the knee cavity. So I'm going to use my ballpoint pen just to make an impression. So once I cleanse the area, I don't have to touch it again. And stick. And inject. I'll move the leg back and forth a few times, get that to circulate within the cavity. And we're done with the knee.